Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have no conflicts of interest. To receive contact hours for this educational activity, participants are required to attend the webinar and complete the evaluation form, which will be mailed email to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within the next few business days of recording. Following the presentations, we may have time for questions and answer. If you would like to ask a question during the webinar or during the presentation, you may do so in the GoToWebinar control panel. You should see your control panel on your screen. You can send a message through the questions feature. This is where you can type any question you'd like to pose to the presenters. However, be sure to hit send so that the message makes it to us. On behalf of Sigma, we would like to thank our speakers for sharing their expertise with us today. Next slide. Our speakers will consist of the following. Justine Barron. Nurse Barron is a lecturer at Stellenbosch University, South Africa. Her passion is midwifery, and it's also her chosen field of specialization, in which she's practiced for many years. Nurse Barron holds a master's in nursing, a Bachelor of Science in Nursing honors, in advanced midwifery and neonatology, and a Bachelor of Art in Nursing Education and Administration, and a Diploma in Nursing, General, Community, and Psychiatric, as well as Midwifery. Sarah Beth Silver. Nurse Silver is a clinical and administrative leader with over 75 years of experience in the healthcare and support for surgical oncology patients. She practices as a clinical nurse specialist in a surgical oncology inpatient unit at Mount Sinai Hospital in Toronto, Ontario, Canada, and works as an after-hours administrator on site at Toronto Western Hospital. Nurse Silver is passionate about advocating for oral hygiene and is actively leading a hospital-wide oral care strategy. In addition, she prioritizes her work around supporting and mentoring novice nurses and students. Jose Arnold Tarriga. Dr. Tarriga is a nurse who is very passionate about clinical education and quality healthcare. He holds a PhD in education, is a certified professional in healthcare quality, and certified nurse educator. He is currently working as an education coordinator in Amana Healthcare in Abu Dhabi, United Arab Emirates, which is the leading post-acute provider in the Middle East. Dr. Tarriga also serves as an adjunct faculty in a nursing university at UAE. He was also recognized as Healthcare Professional of the Year in 2019 by the Filipino Times Award for the UAE. Dr. Tarriga?
Thank you very much, Dr. Howard, for that very kind introduction. And again, on behalf of my co-speakers, I would like to welcome everyone to today's session. Our expected outcomes following the sessions are to discuss one resource for supporting a transition into the nursing profession, and to describe at least 2 ideas that can be implemented by your next working shift to facilitate a transition into a nursing specialty. So without further ado, let's get the ball rolling.
Okay. Thank you so much, Dr. Tarriga. We're going to start off with our first tip. I just want to put a little disclaimer. I know Dr. Howard spoke about my experience. I actually have 7.5 years of experience. Not quite 75, but just wanted to clarify that before we got started. Tip number 1 is to never be afraid to ask questions, because there really and truly is always something that you can learn. one of the best pieces of advice I got from a nurse mentor was to be curious and be open-minded. There really is just a world of opportunity there for you as students, as nurses, and if you don't ask, then you just won't know. And I'm a big sports person, so I love sports analogies. So there's a quote that I love that's, "Never let the fear of striking out keep you from playing the game." So you're really giving yourself that shot there. So an example for myself of me asking a question is about a couple years ago. I had this question about why our patients weren't brushing their teeth, or why no one was taking a sort of a priority about oral care in hospital settings. So I actually sent an email to the director of the surgical program in my hospital, one of the vice presidents of our clinical operations, and I got answers. I got support, and I leveraged that support to actually help me to develop a quality improvement project. And to that end as well, by having that sort of courage to ask that question, I was able to actually get to the position I'm in today. It helped people see me in a different light as a leader who wanted to take an idea and turn it into something new. And that's where I was able to get that, the opportunity that I have as a clinical nurse specialist right now. So I'm going to turn it back actually over to my panelist, Justine, to ask, what is something that you've learned because you've had the courage to ask?
Thank you, Sarah Beth. So generally, I'm the type of person that I'm not really afraid to ask questions, but in my early days as a nurse, I was asked to go and help out in the neonatal ICU, and this is really not an area where I'm familiar with because most of my work has been in a labor ward. So I saw that the heparin flush, it was expired, and then nobody sort of knew in the surrounding area how to mix on the heparin flush. And then I found the ICU and I asked them, listen, how do you do heparin flush? How do you mix it on? All of those things. So this particular example, it stands out for me just because the response that I got was, how can you be a nurse but you don't know how to mix flush? So for me, I didn't recognize it as a bad thing because it didn't show my shortcomings. For me, I got empowered because I asked the question and now I'm wiser for it. So that person's response to me, it was really irrelevant. It just showed that they don't, or they're not sort of assisting others to learn. So that was an example of where I kind of asked a question. I was brave enough to do it, and I asked, even though the response was not nice, I'm still better off for it. So thank you, Sarah Beth.
Thank you, Justine. Excellent. So we'll move on to our second tip, and that is to admit your mistakes. So learning to admit your mistakes, if you keep it forever, if you hold that in, it's really going to sort of combust, and it may not be beneficial for you. So I'm going to tell you about, and I'll be really frank and honest with a mistake that I made a couple years ago in practice and what I learned from it. So as I look back, it wasn't the most detrimental mistake, but it was something that caused me to do a lot of sort of self-reflection about what I could do differently and how we can really make anything a learning experience when it comes to a mistake. So a couple years ago, I was the second nurse doing an independent double check for a patient who had a patient-controlled analgesic cassette. And we rushed through the process because the patient was in a lot of pain. And in rushing, we accidentally hung an expired patient-controlled analgesic cassette. So we missed a key component of that check, and we actually rectified the situation within 15 minutes. We got a new cassette, but we followed our protocol in submitting an incident report. But as a result of the event, the patient and the family were quite upset about what had happened, ended up actually reporting us to our College of Nurses, which they have the right to do because in Ontario and in Canada, our College of Nurses is there to protect the public. And so through that, I had to go through about 1.5 years worth of investigations and sort of reflections on this event. But it actually taught me a really valuable lesson because we also wanted to look at the root of the problem in terms of why did we have expired cassettes on our unit anyways. So from there, I actually embedded a new practice where when we were doing our daily narcotic counts, or when I happened to notice an expired cassette, I would rectify that situation immediately, so it would mitigate that event from happening from other people. I shared my learning with other people. It's something I actually haven't really openly discussed before, but it actually feels good even today, having this chance to share this mistake that I've had and what I've learned from it. So I'm going to turn it back to my panelist, Dr. Tariga, to see if he's ever had any mistakes in practice and he can share what he's learned from it.
Thank you very much, Sarah Beth. And I guess it really takes courage, to admit that you commit a mistake, especially in healthcare, because we all know that in healthcare we are dealing with lives, and a simple mistake can actually cost us our patients' lives. And of course, when I was new to the profession, I did have a few, nothing detrimental as well. But I guess everyone would agree with me that committing mistakes in a healthcare environment is inevitable because the healthcare system is so complex, And one of the main things that I've learned is to always take accountability and report the mistake, because based on experience, most of the mistakes actually stem from a faulty system. So it's not necessarily the nurse's fault or the nurse that caused the problem, but it could be an issue with the system. So if you take accountability and you report that there is an error, the team can actually look into the system and maybe put action plans in place to prevent the error from happening again. They can correct the system, and in this way it will help prevent other nurses from committing the same mistakes.
Excellent. Thank you so much for that. I think we can move on to our tip number 3.
Okay, so tip number 3 is essentially to clarify if you are having any doubts. And it's always a good thing to clarify, because this can really have devastating consequences if you assume something and you go off on that assumption and it's not actually what was expected. I can recall in my practice, initially when I started out, I always had trouble reading doctors' handwriting. I think a lot of us struggle with this issue. So I always used to be an annoyance to the doctor, because I always used to go to him and say, "Doctor, can you please explain to me what is this that you wrote here?" Eventually I learned his handwriting style, but I never wanted to implement something or do something related to the order if I didn't really understand it. So yes, I was an annoyance, but it was to the benefit of myself that I do not stand in front of our nursing council, and for the safety of my patient. Sarah Beth, was there or are there any individuals at your facility who you can ask for help, or how does it work in your state or region with regard to clarifying things?
Absolutely. So similar to what Justine said, and in Canada, and I'm sure this is universal, I mean, you have to ask, because when it comes to patient safety, that's always at the forefront. So for myself, I've always found that I know who my go-to people are to seek clarity. If I'm reading a chart and, like Justine said, if I can't read that writing, I'm going to seek that clarification. I'm not going to carry out an order that doesn't make sense to me. So I'm going to go to those people. I know that there's always mentors that you can reach out to, whether that's formally or informally too, who can also support me. And I always say, don't feel guilty about asking, because patient safety is first, and that's the important thing when it comes to clarifying your doubts.
Thank you so much, Sarah Beth. I think that we can move on to tip 4.
So tip number 4, don't be too hard on yourself. And I guess this is very true, especially when you are new to the unit, because I know that all of us nurses are so passionate with what we do. And sometimes, like, even taking the restroom, we try to hold into our bladder for 8 hours or 12 hours. So if and when you need to use the restroom, please don't hold it. You can always take a few minutes of your time to relieve yourself. If you need to hydrate yourself, drink before continuing your task. Or if you need to eat, grab those bites so that you can be replenished with your glucose, because we all need energy to accomplish our tasks. Most nurses delay the little things that they need because they focus on finishing a task. But in reality, if you're too hard on yourself, it might affect the work that you are doing, and it might actually affect the outcome of your patient care. So, Justine, if I may ask you, have you had any experience where you've been hard on yourself, and how did you handle it?
Yes, I do have an experience where I've been hard on myself. So when I was starting out in my career once again, I was doing a delivery, I was attending to a birth, and the baby had impacted shoulders. So I felt at that moment that I couldn't manage it, and one of my colleagues came in and she took over the delivery. And when we were done, I kind of felt like inadequate because I call myself a midwife, but I couldn't manage impacted shoulders. So I was really berating myself and feeling that I'm not a good midwife, I can't do my job properly, and I just went into this negative spiral of how I'm not good at my job. And how I managed that is that I went to go and read up on shoulder dystocias, and I asked questions, and I was lucky enough after I had this little incident to observe shoulder dystocia, and I saw how my colleagues were managing it. And right now, when I was still practicing in clinical, I was the go-to person for shoulder dystocia. So that being hard on myself, it prompted me to go and seek information, and from that I increased my competence, and now I can efficiently manage a shoulder dystocia.
So in a
Thank
way,
you.
it worked positively for you then, in a way. So let's move to the next tip.
Okay, so tip number 5 is avoid negative people at your area. And this, I mean, unfortunately, sometimes there are negative people. And this is where it really stems from thinking about bullies, which unfortunately do exist, but we always are trying to work towards having sort of a zero tolerance and no bullies in your work environment, because we know how toxic that can be. What I would say around this is just be aware of people's behaviors, whether they're just having a really bad day, because sometimes that happens in clinical environments where things are fast paced and lots of things are happening. It may impact how they're behaving with you, versus a sort of acts of incivility or actual true bullying that could occur where someone might be doing sort of subtle or repetitive things. As an example for myself, I've encountered this unfortunately in practice where I had a nurse colleague I was working with who would do things like forget to print off a report on our unit for just me, but everyone else got one. One time it actually impacted patient safety where she assigned me a patient but didn't tell me she assigned me a patient. So I actually took that as an opportunity to address it directly with that nurse too. If you're able to, if you're comfortable to, that's what I would always suggest when it comes to managing negative people. But if you feel you need that support, you always have that network of a mentor or a nurse manager or someone in a supervisory position who could help to be a bit of a mitigator of this issue. They can help to mediate any conflicts and help you work towards this. So I'm going to turn it back over to Dr. Tariga to ask what tips you might have for dealing with or working with bullies in your area and how this might be done for you.
Okay, so for me, actually, based on experience as well, it might be sometimes culturally related in a way when we talk about bullying or having some negative people in your area. Because when I was working back home in the Philippines, there is this culture in the ICU wherein the seniors try to eat their juniors. You might have heard of this, seniors eating juniors. And what I did initially, because it's difficult to avoid them since we work together in the area, is I tried to step back and have a self-introspection. So I tried to reflect on my capabilities and my limitations, because most of the time when bullies come to you, they will usually invest on the things that you are unable to do. They will always say that you are unable to do this, you are less than us, you are not at par with us. So what I usually do is I ask them, if they come to me and tell me that you're not good with this and that, so I ask them, can you teach me how to be better on this? So instead of them bullying me, now I have turned them into mentors. So that's how I deal with it. And so far it has worked for me.
That's great.
So
thanks for sharing that.
I guess we can now
move on. Yep.
Yep.
Okay, so tip number 6 is going to be on time. So it's really important to always be on time. It's really not nice to go home late because somebody's not relieving you early. And it's really just a horrible habit. And one should really, if your time management skills are not very good, it's really important to sort of work on that time management skills. And with just the example of relieving somebody for coming on duty, of going off of duty, life does happen. I mean, let's be honest, life does happen. So in the event of something unpredictable happens and you are going to be late, I think it's also important then just to keep the lines of communication open to say, but listen, yeah, I am late, that people at least know, and that it's not just, oh, well, I'm late, so what? It doesn't matter. It kind of also speaks to having respect for the next person's time. So being on time is really very important. Sarah Beth, do you have any comments to make on this?
Do I ever? So for me, if you're on time, you're late. That's my mentality. So I always like to head to things very early if possible, especially if you're thinking about a shift, because when you have to get handover on your patients, or when you need to glance at your patient's orders before your shift starts to get ready to go at 7:30 or 7 o'clock in the morning or at night, you need to be ready. You need to be prepared. So I always recommend, if possible, to be at your shift or at your reporting for duty at least 15 minutes before you're expected to be there, if not earlier. I will admit that I actually have sometimes gone even a half hour to 45 minutes earlier because it helped me to prepare. I would also suggest that make sure you know how to get to work and what your commute time is going to be as well. That's something that's really key. Be mindful of traffic, be mindful of weather. Today in Toronto, even though it's spring, it's actually snowing. So those types of things can actually impact how you get to work. So make sure you know other routes, carpool if necessary, and those types of things can kind of help you be on track.
Thank you so much, Sarah Beth. I think we can advance the slides.
So the next useful tip is for new nurses is to become assertive. And I believe that can be quite challenging for new nurses, especially that sometimes being assertive can be taken as something offensive if you're new to the unit. But when we just have to remember that when you are given an order, for example, you just don't blindly follow the orders or do something that you are unsure of. If you have doubts, you can definitely raise your concerns and ask questions, of course, in a respectful manner. And being assertive also is showing that you are confident with what you are doing, especially that you will be caring for patients. And I believe that if you don't show assertiveness when you are performing something, it might appear to the patient that you are not sure with what you're doing. And of course, even if myself, I see a nurse that doesn't seem to be sure of what he or she is performing, I would not want to receive care from that nurse. Justine, what other ways do you think can new nurses become assertive?
What other ways? So I definitely think assertiveness is a good skill to have. So in my personal experience in the hospital settings, so we're obviously advocates for our patients. So if you know that maybe a treatment regime is maybe not adequate, or you kind of want to advocate for something on behalf of your patient, definitely being assertive and sort of communicating that need of your patient effectively definitely comes in there. So assertiveness is really a good skill to have, even when working with colleagues. If somebody is not doing their job effectively, if you're a shift leader or charge leader, definitely having that ability to be assertive and communicate your wants more effectively definitely does come in handy in the ward setup. So thank you so much, Arnold.
Thank you, Justine. So I think we can move to the next tip.
So the next tip is going to be mindful of what you say to patients and to clients and their family. So you never really want to leave the room saying that you will be back in a minute, because you don't know if you will be back in that minute. And we know that ward setups are really unpredictable. Another example would be, in my case, in the labor ward, to say that your baby, we will save your baby. It's a definite definitive statement, and I really do not have that control at that moment to say that I will save your baby. Rather to say that we will do the best that we can, instead of saying that I will. It's a promise that I really can't live up to, despite my best efforts and my best intentions. So Arnold, I'm going to throw over to you. Have you ever had situations where you had to be mindful, or were you in situations where you were not mindful of things that you said?
Yeah, definitely. When I was quite new, sometimes we make false reassurance to patients or families that yes, I'm gonna come back after a minute or after a second, because of course we would want to please them. And I've regretted saying it, because as what you said, sometimes your shift can be very unpredictable and you might not be able to come back with the timeline that you have promised. So what I'm doing now is I usually just I acknowledge that, the concern that of course they want me to come back, but then I tell them that I might have other priorities if I do have other priorities, because I check the urgency of their concerns, and then if and when there are more pressing matters in the unit, then I try to tell them honestly that I have to attend to something very important or very urgent, but I'll definitely come back with you within a certain duration of time. But I give a more realistic time. Like I don't say I'll be back in 5 minutes. I say maybe 30 to 45 minutes or something like that.
Yeah, it's good not to have short time frames, because the possibility of living up to it you might fall short on that. So thank you so much, Arnold. I think that we can progress the slide.
So the next tip is that if you are unsure, you need to look it up. I think everyone is familiar with the saying that don't go into war unarmed. It's basically like us nurses. When we do something, or if, for example, if you're about to give a drug, please do not go and give the drug without knowing what is that drug for or what are the possible side effects of the drug. Or if you are doing any procedure that you're about to perform for the patient, especially invasive ones, you make sure that you know what is the rationale behind the procedure. Because patients have the right to know about the drug or the procedure that you're performing, and it's one way of also obtaining an informed consent. Sarah Beth, how is this done in your organization? How do you obtain information? And is it appropriate to ask questions from an ordering provider?
Absolutely. So I would say if you don't know things, patients will know that you don't know. They can tell. They have that sort of that keen observation of knowing. So you have to really go in there with that background of making sure you've looked things up, you know the sort of purpose of what you're about to do, the intention of the drug you're giving, etc. And then when it comes to whether or not you can question orders, we all have our critical judgment and our critical thinking caps that we can put on. We have our clinical background to question, is this the right order for my patient? So by all means, we're our patient's best advocates, and we need to be speaking up, and we need to be looking things up to making sure we're doing things appropriately.
I totally agree with that, because we have to be our patient's advocate. Yes.
Yeah.
So our next tip.
Yes, one of my favorite ones. I'm really excited for this one. So night shift, and it says have a cup of tea. So as someone who has done many nights in her career and actually still does when I do my admin on site role, I have a different view. I don't necessarily drink tea, but before we get to sort of what you eat and drink, what I would say in preparing for a night shift is you really got to get your circadian rhythm into the flow of a night shift. So my recommendation is the night before is to try to stay up as long as you can. Sleep in the next day, and if possible, if you find that you just can't do that, then maybe take a nap before you're about to go for your shifts. That way you're nice and refreshed for your night shift, and hopefully gets you into that groove of the night shift rhythm. When it comes to food and beverages, I actually would encourage that you eat and drink healthy options. So lots of protein, lots of good nutrients. I wouldn't recommend coffee or tea if it's caffeinated, only because it just didn't work for me. Like, I don't find coffee or tea keeps me awake. I think healthy things will actually sustain you more. I would pack meals as if you're having your dinner or your breakfast or your lunch. Pack small snacks as well to help keep you fueled, because you never know, you might get hungry at 2, 3 in the morning or 4 or 5 in the morning. So that's what I would encourage to get through night shifts. Dr. Tariga, what's worked for you to get through a night shift in your past?
Before I answer that, I would just like to say that I don't love night shifts, actually. But at one point we have to work night shifts. But I'm glad nowadays I'm working mostly day shifts. But when I was working night shifts before, well, I know that you don't love coffee, but I love coffee. Not the dark ones though. I like the sweetened coffee, which makes it unhealthy. So now I'm a bit guilty. I feel guilty now. Coffee just makes me awake. I usually use the 3-in-1 sticks, and then I have like 3 cups on a night shift, and it just helps me get through the night. And sometimes what we usually do in the unit as well, like in the ICU when we don't have a lot of patients, we try to do some brainstorming sessions, case presentations for new cases that we have that we're not familiar with, and our team usually finds it a bit stimulating. So yeah.
Nice. So lots of different ways to get through the night shifts. Hopefully these tips will help you. So we can move on to tip number 11.
Oh, tip number 11, you are in control of your thoughts and feelings. So this is sort of in relation to having negative people as well in your areas. And sometimes this negative people around you, the bullies, might let you feel that, you are incompetent. So always remember that no one has the right to make you feel incompetent. And again, I'm stepping back and saying that you need to have a self introspection, know what your capabilities and what your limitations are, so that you will not feel that you are incompetent. Because if you consider those areas that you are not competent as areas of improvement, then actually you will be motivated to do something about it. Whether you're a new graduate or a veteran nurse with hundreds of years, with 75 years of experience like Sarah Beth, there is no reason for someone to make you feel incompetent. And if someone does come to you and tell you that you're incompetent or not performing up to par, wanting to make you feel bad of yourself, don't take that bait. Don't believe on that. Always believe in yourself, and don't allow anybody's opinion to define who you are as a person and as a professional. Sarah Beth, have you ever felt incompetent because of what someone said at work, and how did you handle it?
Yeah, so I had a story about maybe a couple months into being a new grad, and I was a patient who had an ankle fracture and was fresh off of surgery in a lot of pain, and told me, you're too young. I don't want you as my nurse anymore. Go away, leave me alone." And I was very distraught at the time. I didn't know what I did wrong. I couldn't understand. So I actually went to my charge nurse and just sort of had a really therapeutic conversation with them about what was going on, asking them what I should do to proceed. I didn't want to make a patient assignment switch. That's not routine. That's not something we needed to do. And sure enough, over time, I just kind of went to that patient in small doses, did what I needed to do, checked on them, making sure they were breathing. I had to do blood work, so I just went at their pace as to when they were ready to let me do that, and I did it successfully. So that, I think, helped my case. And then after some time, and by the afternoon of that same day, the patient apologized to me and said, "I'm very sorry for how I treated you. I did not mean to do that." So I think when I look back at this, like Dr. Tarika said, like, I'm in control of my own feelings. If we have that background, our nursing education, our experience, our skill set, we have to be confident in what we have and what we do. And we can't let the comments of other people who, yes, their patients in particular are vulnerable, and they're in these sort of states where they could be quite upset for other reasons. And there's reasons they're seeking care beyond the initial reason they come into hospital. So we have to keep that and take that with a grain of salt, and really have that thick skin so that we don't take all these comments too personally, and that we can have more therapeutic relationships and continue to do the professional job that we were outlined to do. So that's my experience.
Definitely. Thick skin for the win. The next tip.
That's right.
So the next tip number 12 is, even though you are new, be there to help others. And this is really important because it does foster teamwork and team cohesion. So if your colleague comes and helps you out, it really gives you a sense that this person is caring about you, and it will also lighten your load if they are helping you out a bit. Arnold, have you ever had an experience with a colleague that came back to help you after you have helped them out?
Yeah, definitely. In the ICU, most of the time, we work in teams, because you cannot turn your patient on your own. You cannot move them on your own. You cannot do nappy changes on your own. And there was one time that I had a colleague of mine was busy with a deteriorating patient. So I offered to be his runner. So I ran around getting all the supplies and equipment that he needed so that he can focus on his patient and bedside care. So when the time came that my patient had a code blue, this colleague of mine extended his help, and in fact, he even stayed with me beyond the shift to help me complete the documentations, to help me complete the replacements of our crash cards. So it really pays, when you help other people, because they're gonna give it back to you.
Yeah, thank you so much for sharing, Arnold. I think that we can progress to the next slide.
Okay, so the next tip is, I guess, one of my favorite as a nurse educator. Education doesn't stop once school does. And as what I've said, as a nurse educator, I always believe that learning is a lifelong process. And seeing how dynamic healthcare is, there's always something new to learn. Because whatever was shared to us maybe last year might be considered as obsolete, and new information always comes. So once you finish your nursing degree and you start working, you shouldn't stop learning and educating yourself. Like when you are in a new area, you need to know your competencies and maybe try to maintain them, or better yet, try to improve them, by attending relevant trainings and maybe even certifications to update your skills and knowledge. So, for example, if you work in a critical care unit, you might consider taking advanced life support courses, your ACLS, your PALS, among many others, so that it will equip you with the right skills to become an amazing critical care nurse. Sarah Beth, what are the trainings required where you work, and what have you taken that is above and beyond the requirements to maintain your competencies?
Thank you. So for myself, in my initial sort of staff nurse role, I was in a unit that had an inpatient chemotherapy environment. So at that time, after a couple of years of experience under my belt, I took a certification through the D'Souza Institute here in Ontario for being certified to administer chemotherapy and biotherapy. I don't practice anymore doing chemotherapy, but I want to keep my knowledge up, because I am still caring for oncology patients. I am still caring for and supporting patients who might undergo radiation or chemotherapy. So just to keep my knowledge, and there's always new things that are happening, I do actually recertify every year. So that's something that was expected and asked of us within this working environment. On the side of that, I had an interest I actually wanted to be a manager. I was just dead set on doing that. So I completed a certificate in nursing leadership and management, where I got the chance to take courses on program planning, financial management for nurses, and then it eventually led me to taking my master's, where when you're trying to be an advanced practice nurse, and here in Ontario or in Canada, having a master's is really the minimum to get to those types of roles. I actually went a different route in the end. I'm now in a clinical role rather than administrative role. I certainly appreciate all that a manager does, but it's not something that I'm interested in anymore. And that's where your interest can really evolve. And when you take new courses and do new programs and do different continuing education, you find out what you like, and you find out where your niche is and where you're going to fit in. So those are some of the things that I've been doing.
It's what you said, as we grow older in the profession, you get to explore a lot of things, and then you eventually realize where your niche is. So let's move to our next tip.
So there really is, as I've said this already, there's a whole world of nursing that awaits you. Nursing is not just what you think of on the TV screen or in movies. There's really a lot of traditional and non-traditional roles within nursing that you can really go into. So be really flexible and open-minded. Often your clinical placements in your student environment might actually lead you to what you end up being in initially, but you can change. You can go into a different field. I know there's lots of nurses in the forensic nursing world or in correction facilities. We have nurses who are members of provincial parliament here in Ontario. So lots of opportunities for you. And myself, when I settled into my clinical nurse specialist role, I got the chance to become more of an expert in oral maxillofacial surgery, something I never knew I would be interested in. In addition, head and neck surgeries, again, a whole other world of nursing that I'm really proud to say that I now have some interest. For myself, when I want to look towards my future and beyond, I actually want to become a doctoral prepared nurse. I have an interest in looking at DNP programs, and we actually have our first one here in Canada, a DN program. I want to see myself moving into more of an executive leadership role within the next 10 to 15 years or so. So I always keep that in the back of my mind. Things might change. I might have different interests, but there really is sort of a whole world of opportunities for you. Justine, I was going to ask you, what subspecialties of nursing do you practice in, and where have you practiced so far, and what would you like to do in your career?
Thank you, Sarah Beth. So my subspecialty is midwifery. I did a specialization in midwifery as well. I think I was quite lucky because when I was a third-year student as an undergraduate, I already picked up that midwifery is going to be my niche. So I fell in love with it from that time and continued. As a midwife working in the clinical area, I really didn't have a lot of exposure to medical and surgical. My career sort of just fell where I was just placed in maternity areas. So I think that just sort of gave me confirmation that midwifery is my area. So I think I worked for a couple of years as a midwife, and then an opportunity presented itself for me to branch off into education. So this is currently where I am finding myself now. And again, I do love teaching and learning. So I'm looking at building a career going forward within nursing education. So I'm also doing monitoring and evaluation right now, a diploma in monitoring and evaluation, postgraduate. So I'm hoping that those monitoring and evaluation skills can help with teaching and learning practices and improving that so that we can push out competent and efficient nurses and midwives in South Africa. So thank you for that.
That's amazing. Thank you for sharing that.
Thank you.
We'll move on to tip number 15.
So tip number 15 is know what you can and what you can't do from a legal perspective. And this is very good because you really want to know what are your boundaries of your profession. Once again, it's going to keep you safe, it's going to keep your patients safe. So in my context over here, I need to know what does our Constitution of South Africa say, what does our National Health Act say, what does the Bill of Rights say, because you don't want to infringe on patients' rights as well. What does our Patients' Rights Charter say? We have a scope of practice for a nurse, and there is a scope of practice that is separate for a midwife. So I need to know and practice under both of those scope of practices. And then of course we have regulations as well, which is related to acts and omissions for nurses. And these are all things that you need to know of and you practice within those boundaries because it is there to keep you safe and to keep your patients safe. Arnold, I'm going to throw to you now. What government agencies dictate nursing practice in your area, and where should people go to find out information about your region?
Before I answer that, Justin, I would just like to emphasize that I couldn't agree more regarding this knowing your scope of practice legally. Because for me, coming from the Philippines and moving to the Middle East, there's a lot of differences in terms of the scope of practice that I can do as a nurse. So I really would encourage everyone that if and when you leave your home country and you move to a different country, always know the legalities, because if and when you do something, you might lose your license wherever you're working. In terms of who dictates the nursing practice in my area, in the Philippines, we have the Professionals Regulations Commission Board of Nursing. They're the ones that stipulates the scope of practice for our nurses. And in the UAE, each emirate have their own healthcare governing bodies as well. We have the Department of Health in Abu Dhabi, and we have the Dubai Health Authority in Dubai. And these agencies have their own specific websites where you can access the scope of practice, and that can guide you as to what are the limitations that you can do when you practice nursing. That's it from me.
Thank you so much, Arnold. I think that we can progress to the next slide. So the next slide of tip number 16 deals with when in doubt, carry as much as you can. So these are really just on a practical level. So these items can be a bandage scissor, tape, a hemostat, alcohol swabs, cotton ball, saline flash. So all of these are really useful. It does serve to save you time as well. In our hospital settings, if I needed alcohol swabs or whatever the case may be, I needed to go to a treatment room, which means I need to leave the patient's bedside, go into the room. So the problem with that comes that what if on my way to go and getting an alcohol swab, somebody intercepts me and tells me, but Justine, this, can you please come and handle this crisis? Then it speaks back to promising somebody, I'm going to be back in 5 minutes. And then this unpredictable nature of the ward comes in. So having things on you is really a good idea. I personally prefer always having a scissors on me and alcohol swabs and cotton balls. This is something that I always have stashed away in my pockets. Sarah Beth, is there something that you like to keep on your person in the environment?
Definitely. So before I actually even answer what I usually keep on me, what I would also recommend is making sure when you go into your patient rooms, do a quick scan of what's already there, because we have the tendency to bring in way too much and waste a lot of product. And in our organizations, once you bring something in, it gets thrown out. You otherwise cannot take it out of the room and use it for other patients. So that's one thing I would do first. Back when I was on the front line, I would actually carry a fanny pack. So it would actually allow me to carry more. Big thing I love to carry was saline flushes. So if we were going to be flushing IV lines or PICC lines or etc., that was always something, a go-to that I would need, and definitely lots of alcohol swabs. In addition, not only as a supply, but lots of people sort of have their own tools. But when you have your patients and you want to keep track of everything, I called it my nursing brain. So there's a little paper, a template that sort of I harnessed myself in terms of all the information I would need. When I lost my brain or put it down somewhere and I couldn't remember, I was frantic. I was panicking. But it was something I always keep on me because it would have everything I would need to know about my patients, what's upcoming for them, what's due, etc. And so those are some of the things that I always kept on me when I was working with patients.
Thank you so much, Sarah Beth. We can progress the slides.
So tip number 17 is to chart as soon as you can. Don't wait till later. So this is a big one for me because there's that old saying, if you didn't document it, then it didn't happen. So for myself, and something that I do as a clinical nurse specialist is I meet with all of our new nurses and I talk to them about documentation and what it means. It's really important that our documentation actually reflects the picture of what's going on with your patients and accurate of a depiction of assessments, and to be as thorough as possible. So I always encourage people to take a look at what their organization's policies are or what the regulatory standards are when it comes to documentation to make sure that you're at least meeting those at minimum. I also like to put people in the context of what if your charting had to be reviewed in a court of law? Do you have all the information down that you need to do? If you wait to chart later, it may not be as fresh in your mind. So making sure you're charting at regular intervals, being thorough in your documentation, I think is really key. Justine, if I could ask you, have you ever done things and not charted them or not charted well on them? What does this really mean even in the context for a new grad?
Record keeping for me, it was kind of a journey because when I started out as a newly graduated nurse, I think my record keeping was not what it is today. It became a process for me where I had to learn. So initially you kind of just do the bare minimum, and then as you work and there's incidents that come out, you kind of learn, and then you see, but oh, this time they sort of said I didn't document it and then I got disciplined for it or chastised for it, or whatever the case may be. And then for the next time, you kind of know that, okay, now I need to add this in, So initially when I started out, definitely there were gaps in my record keeping, and I'm being honest about this. I didn't come out being a beautiful, well-rounded nurse and knew how to document. It was a process of learning where I eventually got to the point where my record keeping was about a half a page long, more than a half a page long with a delivery. But what this means is that it keeps you safe. It's exactly as the statement says. If it wasn't written, it wasn't done, because people do go back to your records. And if you did, for me now in my case, if I did a delivery today, 2 months down the line, I'm not going to remember it. So how accurate and how reliable will you be as a witness to say, but you did do something? So it really is very important. And like you say, also what you see must be reflected in your record keeping. So the best thing that I can say is just always think when you write your records is that what I write, somebody else that is not there must be able to see what I see. And this is in terms of IVs, bed position, cot sides, whatever the case may be. Everything that you can think of, possibly just write it down, because you need to paint a picture of what you are seeing. So thank you so much for that, Sarah Beth.
Thank you, Justine. So we'll move on to tip 18.
And the next tip is learn tips and tricks from your new colleagues, like what you are doing right now. So you're learning some tips from us. So when you are exposed into the new clinical area, while you are still under orientation, try to watch every procedure that you will encounter with your preceptors or your mentors, because the more seasoned nurses will always have their own tricks as well on how to do things. But of course, I would like to emphasize that try to retain the good tricks, because maybe there might be nurses who might be doing some shortcuts and might compromise infection control, for example. So be very mindful as well as to what are the tips and tricks that you've learned from your colleagues. For example, for me, when I was new in the ICU, and one of the most common issues that we have with ventilated patients is when they have high CO2 levels or hypercapnia. And I've learned that this trick from our respiratory therapist that while waiting for them to change the ventilator settings, I can actually manually bag the patient to wash off the CO2. And I've been doing it now, like when I have high CO2 levels, and it really worked well for my patients. So Sarah Beth, what are the positive things that you've learned from the experienced nurses that you've worked with during your initial years?
So I was very fortunate that I had some fantastic preceptors, and they had one in particular had this see one, do one, teach one method. So gave me the chance to see her do something, had me do it with her observation, and then I was taught. And it really worked for a lot of things, because sometimes even in our nursing undergraduate curriculum, you don't get to catch everything under the sun, or you forget things if you haven't done them in a while. So it was really great to have something that would take me sort of back to the basics in that approach. For example, I actually never got the chance to insert a Foley catheter on a female patient for over a year after starting as a nurse, which is probably very surprising for a lot of people, but it was something I didn't get to do a lot as a student. So I needed that coaching, and I had that sort of see one, do one, teach one approach that really worked. And like Dr. Tariqa said, I would always say carpe diem, and seize the day for all the opportunities you can in your orientation period, whether that's with your preceptor or if another nurse is doing a unique procedure, something that doesn't happen often. For example, just last week, we did leech therapy on a patient's lip. I kid you not. Something new for me too. I know I can see I'm already shocking my panelists here, but there's always something new to learn. So we always pull each other together, and we learn through it together. So there's always things that you can learn from your new colleagues.
Thank you very much, Sarah. That was quite interesting. So let's move to the next tip.
Okay, so tip number 19 would be to return back to basics. So whenever you are faced with a crisis and you don't really know what to do, kind of always start with the basics of doing a basic assessment of your vital signs and sort of a rapid assessment, and then take your cues from there. For me, in my practice, a lot of the times we kind of get people, women that come in and maybe they were convulsing at home, for example, or they come in and their family members don't know what is wrong with them. So then this rapid assessment is kind of very good, because you don't want to spend time on unnecessary things. You really want to, if it's a crisis, get to the crux of the issue as soon as possible, that you can give targeted management. Sarah Beth, was there ever an incident where you had to revert back to basics? Could you tell us about that?
Yes. So it was actually about 5 years into my career where I had my first patient crash on me, and it was on a night shift, and I panicked. But I had to kind of think back to, what's critical, what's important. I need to stay with this patient. I cannot leave, and I need to rely on my teamwork and my colleagues to support me. So I was actually charge nurse that night as well. I delegated to my fellow nurses to help care for my other patients. I stayed with that patient. I tried to keep myself calm, remembering about oxygenation being one of the key things. And then just really making sure that I had that support to get through this, because it was new for me. I'd never done this before. And luckily I was able to transfer the patient safely to the ICU. But it really gave me that exercise to just, like, in the moment, kind of really think about what are my priorities for my patient? What do I need to do to get through this safely? And how do I escalate care appropriately? And so that's where returning to the basics of that and the fundamentals are really key in getting through a crisis situation.
Thank you so much, Sarah Beth. I think that we can progress to the next slide.
And the last but not the least is to find a place to belong. As a nurse, I would encourage everyone to join a professional organization, especially that something that is aligned to your interest or career path, because we all know that professional nursing organizations promote nurses education and our nursing care as well. And there are a lot of benefits, of course, when you are a member of an organization. If you are not yet a member of Sigma, definitely Sigma is one organization that you would want to be a member with. I myself has experienced a lot of the benefits. Sigma has given me a lot of resources. And aside from Sigma, I am also a member of the National League for Nursing. which is an organization for nurse educators, as well as the National Association for Healthcare Quality, which is an organization for healthcare quality professionals. And both organizations have actually given me a lot of resources that have helped me improve my professional practice. What about you, Sarah Beth? What specialty nursing organizations, aside from Sigma, are you a member of, and why have you chosen this organization?
Yeah, so I mean, I would certainly plug Sigma because we're really big fans of that here. But outside of Sigma, here in Ontario and in Canada, we have the Registered Nurses Association of Ontario, or the RNAO for short. It's really our clinical nursing voice, but it also has so many opportunities that you can take advantage of. It's a group that's not just for RNs, but it's also for student nurses. It's also for NPs. What's great about this group is that there are interest groups that cater to various topics, whether you're a staff nurse, whether you're interested in LGBTQ populations, corrections nursing. There's also regional chapters that you can be part of to network with people who live in your area. In addition, there are scholarship opportunities. There's the chance to actually meet with your local MPP, member of provincial parliament. And I myself am part of the Clinical Nurse Specialists Association, which is a subgroup out of the RNAO, and the Nursing Leadership Network of Ontario. So through that, I've actually gotten grants to help do research and innovation projects, and it helped me in supporting me through graduate school too, with some financial scholarships and bursaries as well. So lots of things that you can, yeah, it's a great organization. So if anyone here is in Ontario, I definitely encourage you to do that, and I'm sure in your respective countries as well, there are similar organizations that can support.
Exactly. So those are the 20 tips and tricks that will hopefully help guide you as you move forward in your nursing career. So I'd like to turn you over to Dr. Howard.
All right. Thank you very much to our panelists for the information today and for spending some time with us today. We do have just a bit of time for some questions and answers. So if you do have any questions, please type those into the questions area for us. And first off, I'm actually going to start with one of the questions that came through. And Nurse Silver, let's begin with you. When interviewing for a job, should I ask whether mentors or mediators will be available to me?
That's such a great question. I love that question. So I would say absolutely. And I know in interviews, there's usually time embedded. Usually the interviewers will provide that time for you at the end of the interview to ask questions yourself. An interview is really as much about the organization to learn about you as it is about you to learn about the organization. So definitely speak up at that point when you have the chance to ask a question, and ask about what types of mentoring and opportunities might be available for you. That's your way to find out, is this the right organization for me? Is this a good fit for me and what I'm needing to grow professionally? So by all means, that's a great question, and I hope whoever asks that does ask that in their interview. As someone who does interviews, I would love to hear that question. So by all means, please ask that.
All right, thank you. Dr. Turiga, I'll pose this one to you and then let it for anybody else who may want to answer. Have any of the presenters had imposter syndrome where they are not sure that they should be in the role that they are in, and what do they do to help themselves?
Definitely. Actually, there will always be a point in your life, at least in my life, that I had that imposter syndrome. When I finished my PhD and then I had a role in education, I felt like I'm not so sure if I'm in the right role or I'm the right person to do the role just because I finished my PhD or something like that. But then what I did was I tried to step back again, because I always go back to this self-introspection as to what I can do, because that's the only way that I would know what are my limitations and what can I do to improve myself. And on the process, I've learned a lot of things, and I am able to utilize resources that help me improve myself as an educator and eventually remove that imposter syndrome in me.
Nurse Barron?
I'm going to lie if I say I didn't have imposter syndrome. I think in my time being a midwife, I definitely did not experience that, just because from my third year I knew midwifery is what I want to do. I was firmly grounded in that belief that this is where I should be, and the way my career unfolded, it was that everything sort of fell into place. I was not placed in other areas. It was sort of midwifery central. So I kind of had that reassurance that in myself, I feel that midwifery is where I should be, plus the way life was unfolding. But when I branched off into academia, I definitely had this feeling of things are a little bit challenging, they're a little bit hard. Is this really meant for me? Am I supposed to be here? So in academia, I did have that feeling, but with patience, I think I definitely did learn that no, there is a space for me here as well. I've got something meaningful to contribute as well. So thank you for that.
All right. Time for just one more question or so. So one thing that I'm going to come back to Nurse Sarah Beth, since you made this statement at least. What are some key questions to ask during an interview to get a sense of the unit culture?
That's a very good question. So I would say what might help you in formulating your question is to look and do a little bit of research on the organization. So if I were, let's say, coming into my organization, I would kind of look into the fact that Mount Sinai here in Toronto and Ontario and Canada is a magnet hospital, and it's Canada's only magnet hospital. So I would kind of look to see what that actually means. There's lots of research about what magnet hospitals means in terms of excellence in nursing. I would look to the organization's websites. I would look to their mission and vision and values, and I would try to formulate a question about that. It could be as straight up as asking, can you describe in a few words what your unit culture is? Because really, that's very telling to know what a manager or what a hiring person from human resources might actually say about that. Or it could be more indirect about, I noticed here that Mount Sinai is a magnet hospital. How does that translate to the bedside? Things like that. You can draw connections and do a little bit of research about the organization and the unit you're heading into. If you, let's say, were a student there, or people who work there, maybe even talk to them ahead of time and find out a little bit more from the people who know it best, what the culture is, or what they might suggest you ask to. So that's a great question. Thank you.
All right. Well, thank you very much for your time today. And to our presenters for all this great information. Sigma's grateful that you took the time to share with our audience, and we look forward to hearing more from all of you in the future. And I'm pretty sure that we definitely will be. So thank you very much. As a reminder to our attendees, please submit any other questions that you may have in the question information, and we will be able to respond that way. So be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at www.sigmanursing.org. And previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us, and have a wonderful rest of your day.
Thank you very much, everyone. Bye.
Thank you.
So much, everybody. Bye-bye. Have a lovely day.
Bye.